All right. Welcome, everyone. This is part of our nursing resilience in education, climate resilience in nursing education series. My name is Hannah Knoll, and I am the Director of Member Engagement and Professional Education here with the Alliance of Nurses for Healthy Environments. Today, I am thrilled to introduce Beth Tremblay, who is an accomplished nursing educator and advocate for integrating environmental health into nursing curriculum. With a comprehensive background in community health and nurse education, Beth has dedicated her career to advancing issues that influence equity in health. The environment is a central aspect of this work. Currently serving as assistant professor at the Almer School of Nursing at Old Dominion University, Beth has been instrumental in developing innovative teaching strategies and curriculum frameworks that equip nursing students with the knowledge and skills needed to address environmental health issues. Her work focuses on bridging the gap between traditional nursing education and the pressing need for environmental awareness in healthcare. She completed the National Institutes of Health, National Institutes of Environmental Health Sciences, Environmental Health Research Institute for Nurse and Clinician Scientist program in 2024, which expanded her knowledge and skills related to environmental health. Her climate and health research and initiatives have been published in peer-reviewed journals reflecting their commitment to enhancing nursing education and practice. Her current research includes exploring heat exposure among people living without consistent nighttime shelter. Dr. Beth Tremblay holds a BSN from the University of Southern Maine, her master's from Old Dominion University, and her PhD from Duquesne. She is a critical care certified nurse, a member of national organizations like Sigma Theta Tau and Annie. And Beth is a co-chair on the education committee for Virginia Clinicians for Climate Action. As an advocate for a sustainable and health-conscious future, Beth brings a wealth of expertise and passion to the discussion on nursing curriculum strategies to teach about climate and health. And I will turn it over to you, Beth. Thank you so much for being here.
Thank you. Thanks for the warm welcome. I'm really excited to see everybody here. And I hope that through this conversation, well, it will be more of a conversation and not just a presentation. So I will try to jump over and check the chat here and there and see if we can answer any questions as they come up, but there will be also a time for questions at the end. So this presentation is titled Designing Meaningful Climate, Health, and Justice Experiences in Nursing Education. And as Hannah mentioned, I'm an assistant professor at Elmer School of Nursing at Old Dominion University, which is located in Virginia Beach, Virginia. So I'm in the mid-Atlantic and just I don't have any disclosures to make. So the intent of this presentation is I'm hoping that you'll be able to identify where in those key guiding frameworks really justify and support the integration of climate and health into our nursing education and curriculum, that you'll be able to describe implementation and outcomes of infusing some of these educational strategies, um, that you can recognize how student-led climate and health initiatives can really contribute to the overall learning experience, and really make it tangible. And as we move into an era of competency-based education, we definitely need to think about what are the hands-on, how can we demonstrate that people don't just know things, but they can use them and apply them. So some of the climate and health in nursing education, I thought, well, how do I frame this? Because we know that we've traditionally always taught at the undergraduate level anyway. We've always taught things like disaster response. We are required to have some education around natural disasters versus man-made disasters versus what do we do? And a lot of it's still really focused on the institutions, the hospitals of how do you respond within a hospital. Um, and what we know is that we really need to think broader and think about whole communities and populations. So that being said, one example within the American Association of Colleges of Nursing, our AACN, it's one of our big accrediting bodies, is they have that domain three of population health. And one of those subcategories is to advance preparedness to protect population health during disasters and public health emergencies. But it does go also further in understanding the impact of climate change on environmental and population health. So just taking that a little bit further and building upon that aspect. We also have a new code of ethics with the American Nurses Association, and we can see things that would support climate and health in a nursing curriculum are sprinkled throughout. Some of what I glean from the new code of ethics is that we have to look at all things that develop a good health and well-being. And that includes environment, includes climate, and that health is a universal right. So there's this real framing of a social justice aspect of climate and health, and that nurses should be engaged in shaping institutional, community, and social policies. So we have to learn how to do that. That we need to bring attention where human rights are being violated, and that may be included by a uh, somebody being limited to healthy air and healthy water, right? So all of these things collectively um, work towards building that argument of how do we get this in our curriculum and how do we get it into our curriculum in a really meaningful way, and maybe sprinkled across the curriculum and not just one single hour dedicated to it in a single course. We can also look at the Sustainable Development Goals. We are part of a global community. The SDG 13 of climate action is pretty clear. And yet, I think that you can make that connection from SDG 13 to every single other SDG without a stretch. Where did I start with this? I wanted a bit more, and I thought, okay, how can I start to infuse climate and health? And the first thing I did was really look at the Eco America Climate and Health Ambassador Training. And I started with the undergraduate community health courses and just said, okay, let's put this series of modules right in there and let the students take this and let's see what they get out of it. And so that first year, we had about, gosh, 80 students do it. Um, and then I was able to introduce it to also our RN to BSN cohorts. So those are our students who already have an RN coming back to get their BSN, as well as our face-to-face pre-licensure students. And then more recently, we expanded this program into graduate and nursing programs. So I'll talk about that in a moment. Um, what are the Eco-American Ambassador training? You probably already know it because Annie has a specialized course. So if you haven't taken it, by all means, go on over there. Eco America Ambassador Training. It's about a 3-hour training. When we started doing this, it was really bit more limited to the universal climate and health. And I think the year after, Annie had launched their program as well. So I give the students a choice of either one, but I really like the Annie version because it is a bit more targeted towards nurses. And it kind of helps those, especially people coming into the nursing profession, it helps them sort of understand what the nurse can do and why it's important for nurses to participate in this level of advocacy, as well as being comfortable assessing for climate related issues in their one-on-one interactions with patients. So we started with the Climate for Health 3-hour training. And one of the things that I really, really love about this is that it does operate through a social justice lens. So we are really very much talking about health equity through the whole thing. It is so well threaded, as well as really providing tangible tools on how do you write a letter to an editor? How do you speak to a legislator? Um, so this is what this is kind of what the Annie Climate for Health Ambassador training says about their own program. Just to kind of reiterate um, how much of a hands-on aspect this training has. Just really understanding the goals of the program, connecting climate change to health by identifying its impacts, talking about how it exacerbates health disparities. Um, uh, it talks about climate solutions in the health sector specifically, and there's a lot that nurses can do to promote sustainability and reduce emissions within the hospital structure. It's amazing how much the our hospital systems contribute to, and our whole healthcare system contributes to CO2 emissions. And so that is one key area where nurses can get involved at more of a system level. It helps the students learn how to communicate effectively on climate and health. It uses evidence-based strategies and really takes it that extra step for mobilizing into climate action. So, here are some of the results we had with our undergraduate. So, I evaluated, okay, how does this go? So, one of the other things that we implemented at the same time as the Eco-America Ambassador training was this thing called a Green Team Walking Survey, which was something that we developed. We we used sort of an Energy Star template and then created this walking survey. So if you guys remember ever doing a windshield survey for a community assessment where you kind of go along and you go, oh, what is the infrastructure here? Are there sidewalks? Are there lights? Is this safe to cross the street here? Are there schools? Those sorts of things that you would see in a windshield survey, we put it into a walking survey along with energy use and sent the students out in in teams and said, okay, we're going to have you fill out this green team walking survey. And they just go around the whole building. And what they learned is they can't just look, they actually had to start engaging with people. And so they would find the resource, they would find some resources like who are the facility managers? And um, so when they ask, hey, all right, we saw that our light bulbs are fluorescent. They're not LED, they're not the most energy efficient. Why is that? And so what they learn from facilities is we're restricted on what we can buy and when we can buy it. It has to be broken before we can replace it, and we can only replace one thing at a time. Therefore, redoing a whole system is not going to happen. So they get to kind of learn like the budgeting limitations and think, oh, so if we wanted to make this change, we wouldn't just go to facilities, we would have to go to the university itself. And oh, this is a state university. would they be able to, so they really get a hands-on education depending on how much time they invest. So this first go around we had students really did participate, that they increased their awareness, their knowledge, and their intent to act, both in personal and professional climate related issues. Uh, Most of them agreed that doing the Green Team Walking survey increased their awareness of energy use on the college campus. And that seemed to translate a bit to even their own homes. They found that there were things that they hadn't really paid attention to prior to the survey, and now it just stands out to them. So what I like about this is a transferable skill. So when they go to work in a hospital, they're going to be like, "Hey, I just went into this department that's cut shut down over the weekend and every light is on. Why is every light on?" So those are things that they can escalate within hospital systems, and little cost savings and energy savings add up to a big impact in CO2 reduction. Um, so most of the students also reported having a greater understanding of the connections between climate and health. Um, and one of the things that I thought was really important is about three-quarters of them, it actually increased their confidence in speaking about climate and health. Many of them in class informally would say, it's really scary to talk to people about that because it's so politicized. And it can make, especially a young, 20-something new nurse, um, fearful of polarizing having a polarizing conversation, not being able to connect with their patients, or um, i- in some way distancing themselves for their patients so they can't do their best job. Whereas this gave them the confidence of going like, "Hey, I really want to talk to you about this with you because you have cardiovascular disease or you have asthma, and this matters to you, and I want to tell you why it matters to you and what you need to do to improve your health or to maintain your health." Um, and so more than half of them did recommend this learning activity to other students, which I think is always the biggest thing. But we did see that they had quite a few insights, and really did start to make those connections on how advocacy and connection with their patients can make a difference. And so some of our students got so excited about this that they became Eco America ambassadors. So you can see the picture of the four students. You can see that they have a PowerPoint up in the back. They went and did the ambassador. They used the ambassador training tools, and they went onto main campus. Um, and gave a presentation to freshman students who were health intended majors, um, about the connection of climate and health. So it was really, really exciting. Um, and then over on the right side, the young lady there, that's Trisha, she graduated in 2023. And so she and a couple of other students took a lot of the information that I just presented to you, put it into a poster presentation, and framed it for the National Student Nurses Association to explain how how this could be integrated into other nursing, not into nursing programs, into nursing curricula. So, and that was very successful. They had many people stop by and ask lots of questions. So the students sort of got this idea and just took off with it, which to me says a whole lot that they were that excited about it. So more recently, we thought, okay, so we're getting the undergraduates involved. What are we doing for the graduate students? Um, and so we introduced this into a policy course so that all of the graduate students in our nursing programs, and this is master's and DNP level, and the master's programs are pediatric nurse practitioners, neonatal nurse practitioners, psychiatric nurse practitioners, and nurse anesthetists. Um, out of, um, I believe it was 157 students. Um, so you'll see the numbers beside the statistics here. Those are the numbers of people who responded in that way. Um, but most really agreed that they were more knowledgeable about the connection between climate and health, that they felt more confident discussing climate impact on health with their patients, and with other healthcare professionals. Um, Less so, but still quite a few, over 70% thought that they would be more confident discussing climate impact and health with policymakers. Um, and and we had a little less who were like, "Oh, I'll advocate for climate actions, after." But still 65% is a strong amount. That's a strong number. Over 100 graduate students, felt that they could actually advocate. Um, Most of them recommend the education modules to other nurses. They felt they were beneficial and that they were more likely to take action to mitigate climate change after taking the module in some way. Um, and one of the things that we thought was really great is 19 of the students attended the Virginia Clinicians for Climate Action Legislative Day. So they took that opportunity, they took what they learned through these modules, and then they had this supported environment to go and sit down and talk with some legislators about how climate affects health. Um, and as you guys know, it's so important for us to get involved um, in voicing how making that connection for our legislators because they really don't know. They absolutely really don't know. Um, this is just another picture of a climate and health ambassador training that I was able to do. So this is Ben. He's one of the directors over at Eco America. And so this presentation was at the SNRS in, it's 2023 or 2024. Time doesn't travel linear anymore for me. Um, but this was done as a pre-conference. And what was really interesting is that we had a number of graduate students who came to this training. And um, the more, you know how the more you get involved with something and the more you know, it's almost as if you expect other people's basic level to come up. And so it's always a good reminder when when you enter a space where people are like, "Hey, I didn't know anything about this." So there were two things that I really gleaned. One was that there really are different levels of climate engagement and environmental um, mitigation around the country. One of the women in the group said, "Oh gosh, you know." Where we are in Texas and we're so rural, I don't think there is a place to recycle. So, recycling has been around for years and years and years and years, and still there are people who don't have access to being able to recycle things. So that was interesting. The other thing that was interesting is that Ben did a really great job of walking people through how to write a letter to the editor or an op-ed or a letter to a legislator, um, and taking those pieces. And still, even with the walking people through, they struggled. So I would think that would be a really great idea for ongoing workshops of like, how do you take the one thing that is really important in your practice, whether you're a pediatric nurse or mother baby nurse or a critical care nurse. One thing that you've seen where climate and health are connected, how can you connect that to something that is happening in the legislator with the legislative bodies right now and make it timely, and be able to advocate in a way that could push some policy change? Um, I think that's something that we need to continue to do and work on. Oh, there we go. Um, so another student project that I wanted to share, this was one of the funnest projects, and I hope that you will take this project and run with it. I had the opportunity to apply for a small grant with the National Student Nurses Association and 3M Littman. And it gave us enough money to create these disaster preparedness kits. So in the upper left-hand corner, you can see what the supplies were within this kit. The our our department donated these nice lunch bags. They have some insulation. We really wanted to have an insulated bag because people sometimes have insulin that they need to take with them, or um, they need to bring breast milk for newborn babies that they've pumped when the power goes out and they have to evacuate, right? So these are all just sort of some is basically a starter kit. Think the most valuable thing that we found was that fireproof bag. It's both waterproof and fireproof, and so that allows people to put their important documents right in there, as well as some cash. If they only had time to grab one thing, that would be the thing. Um, so the students, because this was a leadership project, the students were really responsible for identifying what they would include. So they had to do some reading, they had to go to the research, they had to look at the websites and figure out what would be what will people need. And then what we learned, and you can see them putting all these things together, and what we learned by going out into the community. So we partnered with Virginia Department of Health. We also partnered with Portsmouth Parks and Rec, and we went to, in the lower left-hand corner, you can see we were at a place called Senior Station. That was a particularly meaningful education event. The Medical Reserve Corps was out there doing some teaching, and then the students did a great educational session with, I believe it was about 45 seniors who lived in Portsmouth. They come to Senior Station at lunchtime for a meal, for a free meal. Many of them are living so far below the poverty line. So you think, oh, what's the starter kit going to do? These are items that they would not be able to afford on their own. Um, and what we learned through this educational intervention was really we learned from the participants because of the questions they asked. Um, One of the big questions, because we had all the evacuation routes mapped out, and hey, here's your resources. This is who you would call. This is how you find out how to evacuate if you need to. But there were so many of them who did not have cars, who were um, no access to any transportation, not with family, not themselves. Um, if they got around, they used the bus or shuttle services. And they were like, "Hey, what would happen if everything flooded? How would we be able to get out?" And so, yes, cities often do have transportation routes, but it wasn't something we thought about before we went into it. So it was a good learning experience, and so we had to figure that all out and get back to the group. We also did some nice health fairs where kind of people were walking by, and it was more of a one-to-one education. Overall, the students did an amazing job. They learned so much. Um, and it was more than just learning about it was more than just learning about the disaster preparedness, what they really learned was through their reading, they really got an idea of how climate change was increasing the risk for experiencing a disaster and needing to survive a disaster. And this is just a picture of the article that they published in Imprint, which was another amazing experience for them to be able to pull together everything that they did and share it with their peers. So I wanted to just give you some additional resources. Of course, Annie, there's lots of lots and lots of educational material through Annie, and this is the website that you can go to. Um, the American Public Health Association, I know I'm going from bottom to top, but there's a reason for it. The APHA does have some extreme heat resources hub and some other interesting climate and health, um, all related to health equity and population health, as well as public health. But one of the really important resources that I want you to have that is continuing to develop is this global consortium for climate and health education. So this is Brigham and Women's Hospital, Mass Gen, University of California, San Francisco, Emory University School of Medicine, and I don't think I've got it up here, Columbia Med School. So it's this site is at actually Columbia EDU. So I've given you a couple of resources here, but what is here is not just there's podcasts, there are videos. Um, but as you get into this program, it's a little hard to navigate, but you can look at curriculum 4 and it has, medicine, pharmacy. It has an area for nursing. So there are textbooks, there are articles, there are just so many plug and play, ready to go. So if the Annie Eco America module is not enough for you, and you want more and you want to integrate this across the curriculum, the GCCHE is an incredible resource. They also have some slide decks that really break down their case studies. So if you were going to integrate this, say, into an adult health or a pediatric health course, you could pull out some case studies that really show the link between, say, air pollution and asthma. In a way that is more interactive for the students so that they can learn and you can evaluate at that level. Um, and here are some resources as well. And then I think that's what I have for you guys today. Um, but I also do want to know, let me stop sharing. I also wanted to know a little bit about what you are seeing in your schools or in your practices with climate and health, and um, are you seeing nurses being as prepared as we think that they need to be? And have you seen any interesting innovations into improving our level of knowledge and our ability to connect climate and health in practice? And you can, I think you can just speak up or put it in the chat. Yeah. So Heather, you find that most of your colleagues don't even address it, and they prefer to focus directly on patient care. And I think that right there says a lot. um, because there is such an argument for this is part of direct patient care. So when we're talking about, hey, so after you go home, this is what you need to know. Um, so for example, our summers are getting hotter. We're having more and more high heat days. And so when we're doing our discharge instructions, we're saying this is a bedside nurse doing discharge instructions. Um, let's say this is a patient with congestive heart failure, and they are on diuretics. Isn't it our responsibility then to understand that their diuretics and during high heat days we might have a problem? Um, so there are a huge number of medications from cardiovascular medications to psychiatric medications that are all impacted by heat exposure, by the human taking the medication being exposed to heat for long periods of time. So I think that there is definitely this need to bridge uh, that information in pharmacology, for example, to an actual patient in an actual bedside. And then, how do we help people understand indoor air quality and outdoor air quality and use those numbers that we get on our phones, right? We go, oh, the air quality is such and such today. What does that mean for me? Well, it's going to mean something different for an asthmatic or somebody who has had a cardiac event than it means for somebody who does not, right? Or what does it mean for my child? So those, I think, Heather, you're a pediatric focus. So what does that mean for my child? We know that children have smaller airways, especially boys. So they're going to be more sensitive on a day when the air quality isn't as good. So maybe we want to limit the outside exposure on days like that where air pollution is really high. But absolutely. Um, all right, Nancy, the advocacy part is key. Yes. Um, yes, Sierra Club, and engaging students. I love that. Yes. I love that. I think the advocacy is huge, and to be able to integrate how to in a really in a real way is so important. Some of these issues are so big that I find I when I'm talking to students, then there's this sea of really distressed faces because I haven't gotten to the advocacy part yet. They're just like, but what do we do? You know, there's fear, there's anxiety. They're holding a lot of eco anxiety. Hannah, were you going to jump in?
Yeah, I was just going to mention I was talking to another colleague recently about, this. We're so focused on accreditation. And so thank you for including those. Like, why is this important in accreditation? And it is. And the other thing is test is the boards. So we're very focused on getting our students ready for passing their boards. So I think perhaps another route of this is important is getting people like us on the call today to apply as test question
Mm.
writers, so we can incorporate these concepts into the curriculum because then it's on the boards, and so that kind of gives faculty a little more push to include all of these things in the curriculum.
I love that. I love that. And our world is changing and nursing is changing and we need to change. Um, and then while you were speaking, I was thinking of, oh yes, and some of the next steps for all of us who have any kind of influence within schools of nursing. We have the Global Nurse Climate Challenge, which is awesome. Sign up for that. Um, Medical schools and some nursing schools have done this, but have you guys heard of the planetary health report card? Um, If you have, great. If not, it tends to be a bit more medical school focused, and it really rates how schools, healthcare in general, are doing integrating planetary health, which is climate and health, throughout the curriculum, which is which is interesting. It's a little harder for us to do, right? In nursing, we don't have our students for 4 years like in med school. We might have them 4 years altogether if they go through graduate school, but by then they're in a different program. They've got different professors, and so it isn't quite as integrated. But I was thinking more and more about how Annie could maybe develop um, our own nursing planetary health report card. And assessing is a first step to understanding how we can do better integrating these concepts through. It's a pressing issue. It's a very pressing issue. So thank you for all of those other
Yeah, I've been thrown. I'm doing a presentation that's similar this afternoon. And so I have some links, and that the Lancet survey on
Mhm,
climate and health education in nursing institutions that's being done by the Global Consortium on Climate Change and Health and the Lancet
mhm,
indicator, like you said, that will absolutely, I think, help us understand where it's being used. Not necessarily how, but I think that is how the School of Nursing commitment and Annie kind of can come in.
mhm,
We have had a lot of interest in that School of Nursing commitment. We've done this webinar series. We did a lightning presentation round where 15 faculty shared 5-minute presentations on how they're incorporating it into the curriculum. And I think the next step in over the coming year will be to create some sort of toolkit
mhm,
where we take those assignments that these faculty have done and put them in a teaching plan
mhm.
format so that people aren't reinventing the wheel. They can go to this toolkit and just pull from it and have those case studies, have the learning outcomes that are necessary that meet the accreditation competencies and meet, testing for
Mhm.
boards. And so
Yeah.
that is, I will say that is in the works. So definitely stay tuned for more.
I love that. Yeah, yeah. And everybody is thinking about, okay, competency-based education. What does that mean? What does that look like? And how do you do it? How do you do it so that when you are in whether it's a primary care visit, a hospital visit, that you do feel safe and comfortable having really critical conversations about how the climate is affecting our patients' health all the time, all the time. So love that. Good. Any other questions or comments? If not, I want to just thank everybody for joining in today. So something I just love to discuss, and I hope I'll have a chance to learn from all of you coming up.
Thanks so much for
Thank
joining,
you.
and see you later.